a new device that's out, and it's called SureTouch. And basically, it's another screening device tool. And what it does is it's a better way for the clinician or the doctor to do a clinical breast exam. And it assists the doctor with doing that by having 192 sensors in this probe. And what the doctor does is they'll do a breast exam using this, just like they would their regular breast exam, but it records it. And so it's reproducible, it lasts, so that other people can compare it. So what you see on the left-hand side faintly is a normal breast. You don't see any masses or any lumps. And then this is an abnormal breast. This is a breast cancer. And you'll see what it shows is not only the size and the shape of the abnormality. So this is a cancerous breast. So it's a great adjunct to the clinical breast exam. So it's another tool that's out there to think about using in the battle against breast cancer.
Here at OC Breast Wellness, they have the revolutionary radiation-free technology SureTouch. It's both safe, comfortable, and accurate.
I have been having mammograms probably for the last 15, 18 years. It's one of those experiences where you just basically have to work through the pain.
I'm a nurse, and when I was in nursing school when I was 18 and we were learning about self-breast exam, lo and behold, I found a lump. So pretty much from the time I was 18, it was recommended that I had a mammogram almost every year.
Having your breasts just crushed into that small space is rather a not so comfortable experience.
I'm here with Janice, the owner of OC Breast Wellness Center. Thank you so much for having us. So what is your history with the experience of getting mammograms?
I have breast implants. My 17th mammogram. I left in pain, but this time it didn't go away. It took about 6 months before they realized when I couldn't lift my left arm that they were both busted. And after that I said, I will never have another mammogram. So I'm trying to create something with SureTouch that's just the opposite. It's warm, it's friendly, it's compassionate, something that women can have at the age of 20. There is no other breast exam out there for them.
I am here with Dr. Jason, the developer of SureTouch. How did you get started in this?
So I developed tactile sensors that mimic our sense of touch. Shortly thereafter, my mother developed breast cancer. It just made me realize the simple concept of looking for, feeling for lumps, and that's what tactile sensing does.
It was very easy. It was non-invasive, very gentle.
Very comfortable, no pain. You know, knowing that you're not, having radiation in your body.
There's not the subjectivity of a radiologist having to interpret it.
As I was walking out, I was thinking, I've got to tell everyone about this.
Well, a little bit about my background. I'm a nurse, and when I was in nursing school when I was 18 and we were learning about self-breast exam, lo and behold, I found a lump. And so I actually had my first biopsy, and it was under general anesthesia, because that's how they did it in those days, when I was 18 years old. And now that I'm in my 50s, I realize fibrocystic breasts aren't a disease process, that a lot of women have them. So pretty much from the time I was 18, it was recommended that I had a mammogram almost every year. And I wasn't a totally compliant patient because I was too busy to do that. But, that quickly evolved to not only a mammogram, but standard of care ended up being a mammogram, an ultrasound, and then needle aspirations. And so that was kind of my history, on and off. And like I said, I didn't do it every year, but probably every 2 to 3 years from the time I was 18 years old. And I've had 2 biopsies. I had my second biopsy when I was pregnant with my second son. And of course, you had the fear that, you heard all these things about hormone-induced breast cancer. So, I had that done, and then, but a lot of, needle aspirations, and I would go to the local breast center, and they said, they just wanted to make sure they didn't miss anything behind, the cysts. And so that was kind of my history, and it was really funny. I'm a total believer in Providence, because I was kind of done with that. The last time I went in for that procedure, I left. I can't tell you how many times they poked me, how much fluid they aspirated out of me. And I was bruised and bandaged and lopsided when I left. And then I got a $600 bill in the mail, and I said, I'm done. I'm going to die of breast cancer. I'm never doing that again. And that was when my wonderful friend called me. She met Janice, and she had heard of SureTouch. She immediately thought of me and called me up. So it was just like God just dropped this into my lap, and I was just so excited when I heard about it. Yeah.
And how was the mammogram process for you?
Well, obviously it was not just the mammogram. The mammogram was actually, painless compared to the needle aspirations. But it's, of course, it's uncomfortable. You have two metal plates that basically, squish you lean up against it and get your body squished into it. So, it's just not a very pleasant experience. But like I said, and then I would have the ultrasound, but the biopsies or the needle aspirations were probably the worst part of it. And I've been through, to different clinics. I've, worked with different doctors in different settings. Some of them are better than others. They're all very well intentioned. And there really isn't a good, procedure for someone like me. And, like I said, many women are cystic. It's not a disease process. It's just the way that we are. And so there really wasn't a good alternative. And, when I heard about the tactile imaging and, kind of looked online what that involved, it immediately made sense to me. Like I said, I have training as a nurse, and I understand the elasticity and the density of different tissues and how they vary. And so I was just over the top excited and literally called Janice on the phone and said, I think this could work for me. And literally we went down. There were 3 friends that came down, I think within 2 days, and I was just amazed. So.
And how was your experience getting the SureTouch?
It was, I couldn't believe how short it was, even compared to, because I have had ultrasounds, and again, that's as similar of a procedure as I could compare it to. Although I understand the technology behind it's different, but it's even faster than ultrasound. In fact, that the data was there right away, and you got feedback right away. And for me, the experience was like, okay, it was so short. And then the woman, Melissa, that did, I'm like, okay, what do I do now? And she goes, nothing, you're done. I'm like, I'm done? And she goes, yeah, see you in a year. And it was like, wow, it's the first time since I was 18 years old that someone could definitively say I had normal breast tissue. And it was huge. I'm the biggest fan. I tell everybody I'm like a missionary for this, for this procedure. So I'm pretty excited.
Oh, wow, life-changing.
Yeah, it is really life-changing and reassuring, I'm healthy, I exercise, I eat right, but, there's always kind of that nagging thing. And, I've been in the system, I've been through all the standard of care, but I never left all of those procedures with a clean bill of health. It was always like, well, we think we, saw everything there was to see, but to be able to say, yeah, you're cystic, but these are normal, and we'll see you in a year. It was huge. So very, very excited.
I am here with Dr. Jason, the developer of SureTouch. How did you get started in this?
Well, I did my PhD at Harvard trying to give robots the sense of touch. So I developed tactile sensors that mimic our sense of touch. Shortly thereafter, my mother developed breast cancer. She found it in the shower. And we had to go through this laborious 6-month process of trying to figure out what it was, having multiple biopsies. But then I realized that, these doctors are not, ill-intentioned or incompetent. It's just that the tools that they have, primarily mammograms and ultrasounds and whatnot, is not the best tool. Clinical breast exam is using palpation to detect lumps, which is actually how most lumps are detected. 70% of the breast cancers are detected through palpation, despite the fact that we spend billions of dollars on mammography and trying to identify it. So if you think about it, it's really shocking, because there's a very simple concept of feeling for lumps, and that's what tactile sensing does. Just like a digital camera captures what you're able to see, our sensor is able to capture what a physician or clinician is able to feel. So it basically quantifies the sense of touch, and not only that, it's actually more sensitive than typical clinicians, so it can actually detect small lesions. So as the probe is applied to your breast, it's actually comparing the breast tissue elasticity, how hard your breast is, because cancer cells become hundreds times, if not 1,000 times harder than normal breast tissue or other benign type of lesions like cyst or fibroadenoma. So not only the elasticity, but also the shape. So the beauty of SureTouch is that there's no radiation at all. It's basically equivalent of somebody palpating, using the sense of touch. And the other key differentiator between SureTouch and mammograms is that as a breast is compressed in a mammogram machine, the upper outer quadrant is where majority of breast cancer occur. 54, 57% of breast cancers occur on that region.
So you're talking armpit and...
Near the armpit, yeah. So imagine mechanically, especially if you have smaller breasts, there's no way that you can image that region, right? So that's why mammograms really have a hard time or, misses a lot of things as well. The other problem is, there's obviously a lot of false negatives, a lot of recalls, and, more diagnostic imaging focusing on that area and biopsies and ultrasound and all that, which is really traumatic. And that's exactly, what we had to go through, and it was over 6 months, period, with my mom.
The SureTouch tactile breast imaging sensor measures pressure. The monitor displays the amount of pressure and the location of the pressure. Placing the sensor on the training phantom, a reproduction mimicking breast tissue, you can see the force meter change when pressure is applied. This meter allows you to maintain consistent pressure during an exam. Notice there is no reading in the center of the phantom. The training phantom contains reproductions of lesions in different sizes. Currently, we have a 5 mm and a 10 mm simulated lesion loaded into the phantom. A lubricant is used to reduce the surface friction, which provides more accurate results. Watch as the sensor glides over the surface of the phantom. When there is no lesion present, the output is even. Here is what a screen looks like as we move over lesion. A simple button click on the side of the sensor begins the recording process. Palpation ensures the best image. After recording, the clinician marks the location of the lesion on the breast outline using the touchscreen. Data is recorded and can be looped in playback for comparison in size and shape against future examinations. The system also calculates the hardness of the lesion. The SureTouch tactile breast imaging sensor can distinguish multiple lesions or lesions that are irregular in shape. For more information about the SureTouch tactile breast imaging system, please visit our website at suretouch.us.
I'm here with Janice, the owner of OC Breast Wellness Center. We've talked to a lot of women about their experience with mammograms. Tell us about your experience.
Well, like just about everybody, I started when I was 40, and I have breast implants, so it's the one thing about having a mammogram that's very uncomfortable, because there's no way that they can get the implant out of the way. So it's always been very painful. I've always left there with a little bit of aches and pains. But about 5 years ago, I actually left and the pain didn't go away. By that time, my implants were pretty old, about 22 years old. And it took about 6 months before they realized when I couldn't lift my left arm that they were both busted. It took a long time, two surgeries actually, to get myself all cleaned out and to have new implants put in. So after that, I decided I was never having a mammogram again.
And what is the difference between SureTouch and a traditional mammogram?
You actually just lay down, and like a clinical breast exam, you just pick your arm up and run a tactile sensor over the breast area. And with no radiation and no compression, it generates an image on a computer screen that you can watch the whole time, and it maps the tissue. But I have had a few patients call me back and say that the doctor was just unaware of the exam. And we really want doctors to join us in promoting this exam. It's something that women can have at the age of 20. There's no other breast exam out there for them. So we really urge doctors to take an extra look at it. Go to SureTouchBreastExam.com, look at the clinical information that the manufacturer has on the site. The thing I have to say to all women, 20, 30, 40, no matter how old you are, you can have this nice, easy, non-invasive breast exam and find out if there's anything as small as 5 millimeters. That's something a mammogram can't do.